Now I would like to welcome Sachia Powell. So Sachia is a very special person. She actually began raising funds for ovarian cancer research back in 2011, but that really accelerated after she was diagnosed with ovarian cancer herself in 2017. She subsequently partnered with her gynecologic oncologist and established the Powell-Drescher Ovarian Cancer Research Foundation. And the foundation's mission is to power the future of ovarian cancer research by endowing funds and championing collaboration between scientists and survivors. In addition, Sachia serves as a consumer reviewer with the DoD Ovarian Cancer Research Program, as well as being on other study sections. She is really a gem, and we need more Sachias. So with that, I welcome you to the podium, Sachia.
Thank you. I really want to thank the coordinators for inviting me to speak with you today. You know, in 2019, my mom was hospitalized. Her roommate was an older woman, fairly soft-spoken, who struggled a little bit with English as a second language. She had been diagnosed with leukemia some 9 or 10 months prior, and she had not followed her doctor's advice to have chemotherapy. She was back in the hospital due to complications from her disease. The first thing the nurse asked her was, "Why didn't you do chemotherapy 9 months ago?" And the woman's answer was very clear. And bear with me because you may not like it very much. She said, "I don't like my doctor." What makes treatment worth it for a patient? It depends. It depends on so many factors. Some of them you know very well, but I suspect some might surprise you. And as patients, we have to balance those factors, and how we balance them is as unique as we are individual people. And sometimes our balancing may actually evolve over time in the same patient. So let me tell you a little bit about how I know. I am a daughter, wife, mother, sister, lawyer, smart aleck, and as of 2017, a high-grade serous ovarian cancer survivor. Like many newly diagnosed with ovarian cancer, I knew nothing about the disease, but I became very educated very quickly in all the statistics. I had standard of care treatment. I had debulking surgery followed by 6 rounds of chemotherapy. And when I finished, I had an epiphany. Given the relatively infrequent diagnosis of ovarian cancer compared to other cancers and the high mortality rate, there are very few of us left who can actually speak for ovarian cancer patients. And that's when it really hit me that I'm one who can. And so I've made it my mission to speak up for all those women who can't. So here's what we'd like you to know about what makes treatment worth it for us. Well, it's safe to say that we all want a nice long life. And some of us will try to prolong it simply to hit an important milestone, like meeting a new grandchild. For some of us, we're going to try to prolong it in the hope that if we just hang on long enough, there's going to be a better, more efficient treatment that will be available to us. It's also safe to say that we want our lives to be of good quality, so we have to factor in how tough the side effects will be, how long they'll last, whether they'll be reversible, and how much they'll impact our daily lives. Dr. Kim mentioned some of the ocular toxicities, and those are going to affect someone who has a passion for photography far differently than someone who doesn't rely on their vision as much in day-to-day activities. But many of us recognize that a long life of really good quality isn't always possible, especially in combination. And that's when we start to answer the question very differently. What makes treatment worth it? Well, of course, we're going to consider the likely benefits of the treatment. We'll have to think about, once it's complete, will we likely achieve remission? Or will we at least have a nice long break before the next treatment is required? Ultimately, how much hope does the treatment give us? And we have to factor in the costs, the financial, the physical, and the psychological. We have to think about how much is the treatment really going to cost us, and can we take on that debt? Will it require us to travel, and is somebody available to watch our children while we're gone? Even if the treatment is near our homes, we have to think about how much time from our lives will be dedicated to the treatment. And do we need a caretaker to take care of us, and can they take time from their lives? And we can't forget about the costs of health care insurance coverage. I want to tell you, I have fabulous health care coverage. I am really lucky. But shortly after my recurrence, I spent hours on the phone arguing between my oncologist's office, the billing department of his institution, and my health care provider over coverage of a screening test that everyone agreed was medically necessary. And no one could agree how to code. I ended up paying the 4-figure bill out of my own pocket on the eve of being sent to collections. And I have really good health insurance coverage. Not everybody does. Not everybody has the ability to pay out of pocket. Not everybody has the stamina to put up that fight. So you may find us making treatment decisions based on our desire to avoid all of that mess. Ultimately, we have to think, what are we missing in life if we are not around, or even if we are physically present, if we're so sick or confined to bed that we can't really enjoy it? What makes treatment worth it may depend on cultural or religious factors. A patient with a strong spiritual conviction may put their future into the hands of a higher power. There are certain groups of people who, based on prior discriminatory acts, may be unwilling to participate in biomedical research. And so for them, participation in a clinical trial will never, ever be worth it. Certain families or cultures may downplay illness, and for people from those groups, they may be unwilling to pursue a treatment if it will call attention to their disease. And let's be honest, our dignity plays a role. Some of us don't want to be seen as weak or sick, to get that look from the stranger in the grocery store, that look that says, "Oh, I'm so sorry." Cancer takes a lot from us. It takes our stamina, our hair, our fertility, our more carefree pre-cancer existence. And at some point, we may just say enough. We don't want cancer to take anything more from us. Dr. Kim spoke about the ocular toxicities that are common with ADCs. And I learned that patients on ADCs are advised not to wear contact lenses. I'm a lifelong contact lens wearer, and I don't wear glasses. I hate them. So right now you're thinking, well, certainly you wouldn't use that as a basis to make your treatment decision. I might. Cancer has taken so much from me, at some point I may say, I am not willing to let it take more. Another thing that cancer takes from us is the ability to control our own lives. We don't have any control over the fact that we got cancer. We don't have any control over how our bodies respond to treatment. At some point, we even lose control of our calendars. We may think that we're having chemo on Wednesday, but if our white blood cells didn't get the memo, it's moved to Friday, and all our weekend plans just went out the window. Medium range planning is challenging if you're waiting to hear if you qualify for a clinical trial, or even just to see if you stay in remission. And long-range planning is impossible because it requires us to factor in our own mortality. So you might be surprised to find that we make treatment decisions that seem unwise, maybe even ill-advised, if what we're trying to do is regain or retain some modicum of control over our own lives. What makes treatment worth it? Sometimes it isn't what it takes, but what it gives. If my participation in a clinical trial can produce helpful data that might help somebody who's coming after me in the survivorship, then it might be worth it for me to participate, even if I don't personally benefit. One survivor friend told me that she actually would consider what she gives to the environment. She said, think about all the single-use disposable waste that's generated every time you have a lab draw. Multiply that exponentially every time you have a chemo infusion. She said, if I'm going down anyway, do I have to take the planet with me? What makes treatment worth it? Sometimes it's what we learn from those who've come before us. When I was diagnosed, I discovered that I gained membership to a very exclusive club, a club to which we never wanted to belong, that of fellow ovarian cancer survivors. And you know what? We talk. And my treatment decisions might be based on what I've learned from survivors, or, dare I say it, what I read on the internet. I'm currently taking a PARP inhibitor. I've talked to other survivors about their experiences, and it hasn't always been great. Mine hasn't been too bad. So if I'm perfectly honest with you, I would tell you that my willingness to continue on the PARP inhibitor is because I know that in comparison with some others, I actually got really lucky. What makes treatment worth it may depend where we are on our journey. We know that cancer treatment is equal parts physical and psychological. Somebody who feels physically well may be willing to take on the additional rigors of toxicities. Somebody who's psychologically worn down may not be ready for the proverbial fight. There comes a point for many cancer patients when the treatment and the side effects and the medical appointments and the lab draws, it all just becomes too much, and we want to be done. Whether treatment is worth it may also depend on where our support system is in that same journey. My dear friend Debbie confided to me one day that she was done. She was more than 5 years out from a stage 4 ovarian cancer diagnosis, and she had just completed her last treatment and stopped when it was clear it wasn't working. She could see the writing on the wall. So you can imagine my surprise when a few months later Debbie told me in great detail about the new treatments she was on. Turns out that Debbie was done, but her husband wasn't. He had asked her if she wouldn't try just one more thing, and for him, she had agreed. What makes treatment worth it may depend on how afraid we are of death, of how much in denial we are about our current situation, and the extent to which we and our support system have accepted our own mortality. Some patients come to a point in treatment when they feel like their lives no longer matter and current additional treatments would be futile. I would argue that some of us reach the point far before you realize that we have. So what makes treatment worth it then is whether we are reminded that our lives really do matter up until the very last moment. What makes treatment worth it? Ultimately, it might depend on you. It might depend on what you tell us about the treatment, how you explain the toxicities and the efficacy, and how enthusiastically you endorse it. It might depend on the terms you use, progression-free survival, overall survival, and whether we understand those concepts. You probably discuss many of these treatments every day, and you could probably detail them in your sleep. Sometimes when we know information so well, we may inadvertently gloss over something or forget to emphasize something. Maybe on the day you're talking to us about treatment, you're really behind schedule, and your summary of the treatment becomes a little too summary. It happens. But the information that you glossed over that day might have made a difference to us. Whether treatment is worth it may also depend on what we hear, which, as anybody who ever played the game telephone as a child knows, may not be what you actually said. What we hear can be influenced by our emotional state at the appointment, by cultural or linguistic barriers. It can be influenced by our ability to ask questions and seek clarification. Ultimately, what we hear can be affected by whether we share your first language, your skin color, your cultural or religious background. And what we hear can be influenced by how much we trust that you are looking at us as a whole person and not just as our disease. Oops. All right, well, I was going to go backwards, but you're going to look at this instead. So remember my mom's hospital roommate who decided not to have chemotherapy because she didn't like her doctor? Every time we follow your treatment recommendation, we are quite literally putting our lives into your hands. That takes a tremendous amount of trust. It's really hard to trust somebody that you don't like. So for my mom's roommate, what made treatment worth it was finding a provider who she liked and trusted. For some of us, the decision is crystal clear, and for others of us, it's heart-wrenching. But for all of us, it requires us to balance factors that are deeply personal. And we look to you for the information that we need to balance what the treatment will likely give against what it will likely take away. What makes treatment worth it? For me, it's living long enough to parent my son all the way to adulthood. He just turned 16 and a half. I think we're there. So I want to thank you for all you do for all of us.
Wow, that was incredible, Sasha. Thank you. Thank you for sharing that very personal journey and your insights. I'm sure each of us will leave taking away something as we go back to our clinics and take care of our patients. So appreciate what you've shared with us.